A Team 5 Investigates report brings powerful results, changes to state law.
That's right. Team 5's Janet Wu first reported on doctors who were changing prescriptions from brand name drugs to generics without a patient's permission. And now Janet reports changes are coming.
We can't allow any system to exist that intrudes upon the sanctity of the doctor-patient relationship.
The public health chairman said the bill he files tomorrow will make it illegal for any insurance carrier to financially reward physicians for switching the prescriptions or medical products of any patient. In August, Team 5 Investigates first reported that Blue Cross of Michigan was paying doctors each time they substituted Lipitor with a generic of Zocor. Team 5 Investigates also uncovered a routine practice here in Massachusetts where physicians receive financial reimbursements if they switch enough patients off brand name drugs. Jeannie Holland, who has been on Lipitor for 4 years, was among those switched without her consent.
I know now I don't think it was a good decision, but I didn't make the decision. The doctor did.
I've filed legislation based upon this NewsCenter 5 investigation.
The chairman said saving the insurance company or the patient money cannot be the primary motive for switching medication.
This is something that may or may not be good for the patient, but if there's an incentive involved, we'll never know what the true motivation was for this decision.
Holland said after several months on the generic, her cholesterol scores skyrocketed. The doctor increased the dosage and Holland lost 25 pounds, but her cholesterol level is still too high. She hopes the bill is passed into law.
I'd like them to make it based on what works for me as the patient rather than anything else.
If there are incentives or disincentives that are changing the agreements made between a doctor and a patient that are not good for the patient, then there's something wrong with that system.
Katusian's bill sets a maximum fine of $10,000 for insurance carriers and doctors violating the ban. Meanwhile, Jeannie Holland plans to ask her doctor about switching back to Lipitor since it would only cost her an additional $5 a month. Now, unlike Holland, many patients that switched off Lipitor have had no problems, and it has saved them a lot of money. But Katusian said medical efficacy, not money, should be the deciding factor. Liz and Ed.
Team 5's Janet Wu getting results tonight.